chance to be the voice of people living with HIV in Uganda here today. And I'd love to talk about the role of people living with HIV play in the national sustainability. As we remember millions we've lost due to HIV/AIDS, we'll also love to celebrate those that have lived for their art innovation. Today, I would love to talk about the role people living with HIV play in the sustainability of the HIV national response. As individuals directly affected by HIV, they also bring a perspective, experience, and an insight to inform their effective programming and policy making. My experience with HIV response sustainability. I've seen firsthand the impact of funding freeze previously and the recent freeze on our community. Also, as IAPs, have been part of the communities that continue to support my fellow young people living with HIV to stay on art and adhere, to also participate in research and advocate for the end of stigma and discrimination. We all know there are people out there that can't reach here, that are not given a chance to come out, but they're stigmatized and discriminated in the communities. The recent funding freeze and termination stand alone the TB clinics. We were stopped from working. Lots of adults and out there and young people living with HIV lacked treatment. Some of them got lost. We now trying to bring them back to the clinic due to the freeze. These have threatened the sustainability of virtual life, saving HIV prevention, care, and treatment support. Our response as people living with HIV, through our mother network, Nafufano, we have mobilized and advocated through the Ministry of Health and the Uganda AIDS Commission, and engage for the increased funding, policy changes, and the HIV response to fill the gap that was created by the freeze. Looking ahead, we all continue to advocate and support each other to push a future where everyone living with HIV can thrive. Our ask from the government, the civil society organization, and the stakeholders. This goes to the government. The government should allocate sufficient funds to sustain the HIV services, most especially for the art part, where these people need treatment. We also, when the freeze came in, people lacked where to get the art from, and they were afraid they're not going to be given services anymore. And this also goes to the government. The government should also develop and implement policies that support people living with HIV. Such policies protect them from being discriminated in the society and also protect them from stigma. Still, the government should engage people living with HIV in decision-making policies, because you can't decide for someone without listening from them. So the government should look into it. To the civil society organization, amplified advocacy. The civil society organization should amplify people living with HIV voices and their concerns. Capacity building. Provide capacity building opportunities to people living with HIV to enhance their skills and knowledge. The support system. The civil society organization should support people living with HIV with counseling, peer support, just as one of the panelists said, These people are supposed to be given support, and also look into their referrals. And this goes to the stakeholders. Mobilize resources to support people living with HIV programs and services to their areas of operation. And lastly, as I'm closing, still to the stakeholders, promote stigma reduction efforts, misconceptions and practices that increase HIV infection, most especially in the young people.